role does robotics play in a surgery center and scaling a joint program? There's a lot of buzz out there. Pretty much every manufacturer has some sort of robotic system. I know you guys are discussing that now internally, whether you should add robotics to the center or not.
When you have so much growth like our center does, there's a lot of competition to want to get into that market, and so you should definitely use that as an advantage and leverage the different vendors to get the best product.
Does that tie into implant pricing too?
Yes, definitely use that as an advantage, because most companies, I think you need to get in the mindset of they're selling implants, not robots, right? So just make sure that you are firm with your negotiation with the vendors and use that as a leverage to get your implant pricing down and all of the disposable cost that's associated with robots. And I think getting the surgeons in that conversation helps in addition to the administrator, and just really kind of, showing them the data and our potential for growth.
One of our surgeons has been doing this for last year or so. He mentioned the fact that the word is out, patients are coming to see him seeking the robot. Mm-hmm. They're candidates for outpatient surgery, but we don't have a robot there, so he ends up doing it at the hospital. So the patients are getting the robotic, but they're not getting the benefit of being done at a high quality ASC. So I think the wheels are turning and it's going to happen. And my prediction is in 10 years, that's going to be the standard of care.
I think to me, it comes back to delivering value to the patient again. I think if you can provide a better product with some extra technology at a lower, at a reasonable cost, then that's something you have to have.
Is our outpatient arthroplasty here to stay? Do you see anything that would derail this, or is this the train that's left the gate and it's only going to get more and more refined?
COVID has accelerated it, and everything's proved that it's safe and better.
You have to deliver quality, add value. I think that's what the surgery centers do better.
I agree. I think if the whole setup is based on increasing your profit over quality, it will fail and it will not do well. So that would be my message.
Really impressive what you guys have done, from administrative to the physician leadership all the way through. Do you see any differences in the future? I mean, you guys have made a lot of investments. You've scaled really nicely to, showing you can do more than 50 per month, and you're consistently doing that. Where do you see yourself growing to? Where do you see your capacity? And also, are there any comments around centers that kind of dabble in total joints and don't really make the commitment to have a program like you guys have established?
It takes a lot of investment financially and organizationally to get to where we are right now. It's not something that you just flip a switch and it happens. I mean, anybody can do an outpatient joint, I guess, but you need to have all the structures in place to do it well and safely. I think patient safety has to come first. I think you have to be comfortable with a certain level of capital expenses that are part of a program like this.
We'll be at some point limited by space and resources, at which time we will probably have to be ahead of it and try to figure out a way to have more rooms or change where we have the patients recover and so forth, because it will eventually get to a point where we're running out of space and storage and staffing, and that will be a good thing, but we would have to be ahead of it when it does happen.
Shay, how many cases do you guys do at the center on a monthly basis overall, not just total joints?
Well, our specialty is ENT general, orthopedic, and pain management. So we probably run anywhere between 600 to 750 cases. There was a couple of months where we almost hit 800, but and it's about 50% surgical and 50% pain management. Mm-hmm.
Okay. So of the surgical, you've got 350-ish, and about 50 of those are tracking on the total joints.
Correct.
Got you.
Yeah.
All right. Thank you, guys. It's been a great session. I appreciate your time, and good luck in the future.
Thank you.
Thank you.